In this next video, we're going to be talking a little bit more about neutrophils. So in our last video, we talked about the different types of white blood cells, the 5 different types, and neutrophils being the most numerous type of white blood cell. But it's also important to understand that blood cells, when they are first made, when they're born, they don't function as well as mature blood cells that have been able to differentiate themselves from their infantile form. And specifically with neutrophils, since we know that they are most specific towards bacterial infections, we can monitor these, and knowing that those that are being born faster, or when those are being born faster, there's a reason that the body makes them faster, and then a reason that the body would slow down in making these neutrophils as well. So in their infantile form, we call these neutrophils banded cells, because when they start off, the nucleus of the cell, it actually takes up the majority of the cell, and then when it starts to develop more, it takes up a little bit less, and then it starts to form this little band within the cell itself, so that the nucleus actually looks like just a single little band across the cell. As it matures a little bit more, it starts to segment into, or the nucleus actually starts to segment into little bitty parts, and we get a segmented neutrophil. So we say that neutrophils are either banded in the sense that they are immature, or segmented in the sense that they have become mature. Those banded neutrophils do not work as well as the segmented neutrophils because they are younger. And what this actually tells us is that when we have a larger majority of banded neutrophils, that means the bone marrow is actually making more bands or more neutrophils in a very fast rate. And this sudden increase in banded neutrophils is usually the result of a bacterial infection, because as the body is introduced to into a bacterial infection, it has to respond in some way. Well, since neutrophils are the one cell that actually helps us fight off those bacterial infections, the body's response to a bacterial infection would be to make more neutrophils, and it can only make those neutrophils in the banded form. So we call this a shift to the left because, as you see on here, we all read from left to right. So a shift to the left would be more banded neutrophils in the sense that we are reading this little chart from left to right. In a shift to the right, however, we actually have a shutdown of the bone marrow so that fewer and fewer banded cells are actually being made. In this case, we typically are seeing a suppression of the bone marrow from some sort of drugs like a glucocorticoid or a chemotherapy drug. And in these shifts to the right, these are fairly uncommon in somebody who's not taking some sort of medicine to inhibit the bone marrow, or when somebody actually has a disease that is inhibiting the bone marrow. One thing that we can look at to identify these shifts to the left and shifts to the right is that banded forms should be roughly 3 to 5%. Anything more than that, or anything more than that 5%, we're starting to have a little bit of a shift to the left. And when we start seeing more than 10%, we have a pretty severe shift to the left. And this is when we should start thinking that somebody may have a bacterial infection.